COVID-19 vaccines are at best 95% effective, which is amazing. But some vaccinated Utahns will still contract the virus, and in fact they are. Our content sharing partners at the Salt Lake Tribune discovered there were 993 documented cases of COVID-19 in fully vaccinated individuals in Utah. Now that's a small fraction of the cases contracted by unvaccinated people since vaccines became widespread. 3 of those breakthrough cases ended with a death, though. That is a rate of 0.3%. Now the overall Utah death rate from COVID is twice that at 0.6%. Of the breakthrough cases the state has sequenced so far, only 2 of them were that Delta variant we've been talking about in other parts of our newscast. That's the one that originated in India. It is fast becoming possibly the most common strain or variant identified in Utah. So to go through some of these numbers, because it's really good information, joined by Taylor Stevens with the Salt Lake Tribune. You wrote this story. It really was helpful to see these numbers, these breakthrough cases. Help us understand, those who are vaccinated, they contract the virus. Do they have milder symptoms? Is it, what do these cases look like?
Yeah, so what we're hearing from the health department is that people who have contracted COVID-19 post-vaccination are having much more mild symptoms. And so they're encouraging anyone who has symptoms consistent with COVID-19, whether that be fever, cough, fatigue, to still get tested and not sort of dismiss that as a cold once you've taken your mask off. That you should still get tested just to make sure so you can avoid spreading that to other people. But we are finding that the risk, as you mentioned, of death and hospitalization among people who are fully vaccinated is much lower if they do happen to contract COVID-19.
And help us understand the perspective of these numbers. You mentioned 993. As you were talking with the folks at the health department, and I know you were talking with an infectious disease specialist as well about all of this, what were they saying about that number compared to overall who is getting the virus in Utah right now?
Yeah, so 993 breakthrough cases out of 1.3 million Utahns who are fully vaccinated really is a minuscule number. And so they say that they always expected there to be some breakthrough cases. No vaccine is 100% effective. So this is not out of line with what was expected and actually shows that the vaccine is highly effective at what we've been promised it would do, which is prevent severe illness and death in most cases.
Yeah. When we talk about the goal of vaccines, I mean, we all want to protect ourselves, our loved ones, but that overarching goal of herd immunity, how does that factor in? What do they say in regard to the numbers that you were talking about?
I didn't really broach that with the health department as far as these interviews go. We were much more focused on the breakthrough cases, but I know they do have a goal of reaching 70% of Utahns who are fully vaccinated by July 4th. I believe we're somewhere in the 64% range right now, and so we're still sort of headed in that direction. Having our younger Utahns 12 and up having the ability to get vaccinated has helped in reaching that goal because we do have such a young population.
And as you were looking into this, did you talk with any folks who had these breakthrough cases who'd gotten fully vaccinated and then found that they got the virus?
I didn't talk to anyone personally, but I actually myself did have one of these breakthrough cases, which sort of prompted my interest to look into this and figure out how common it was in Utah.
Oh, so what was that, if I may ask, when that happened, did you just feel like, oh, well, that's... boy, I'm the one with the really bad luck, or did you feel like, or did you? How bad did it get for you?
I think this is part of why it's really important that people get tested, because I initially did not really come to mind that I might have had a breakthrough case. We know they're so rare. And a lot of people that I knew said, oh, why are you going to get COVID tested? You're vaccinated. And so I think it's just really important that people recognize that this can happen. I feel like my case was much lighter than it would have been otherwise had I not been vaccinated. So it was an interesting experience. Definitely very shocking to be 1 in 1,000 that we've had in Utah so far, but all for the best to getting vaccinated, getting tested so I could avoid spreading it to other people that I knew.
And one thing we're seeing in Utah right now is that the percentage of positive tests is going up. Fewer people are going in to get tested, it sounds like.
Yeah, and the health department does think that this number is a bit of an undercount, as is likely the number of people with COVID-19 cases who are unvaccinated, because it does rely on people actually going and getting tested. And so, just again, want to reiterate, if you have any of these symptoms, it's important to go get vaccinated so you can isolate and avoid spreading it to people who, either don't have a good immune response to the vaccine or who have been unable to get vaccinated for, their own health reasons. That is still the case among some people who are unvaccinated.
All right, Taylor Stevens with the Salt Lake Tribune. Hey, it was a very helpful article. Appreciate that, and I'm glad to see you in good health, knowing that that you did have one of those breakthrough cases. So, thanks very much.